Hi, I'm Dr. Folatami Akinriade. I'm an occupational therapist. The purpose of this video is to discuss people, whether they're parents, teachers, therapists, that try and get kids, mainly neurodivergent kids, which includes autism and ADHD, but trying to get those kids to work on their eye contact. When I speak with parents, I ask them, why exactly do you want them to have better eye contact? Like, what's the purpose? What's the true outcome or goal that you want to work on with them? And they usually say that it shows that they're paying attention. It is socially normal or expected for them to be able to make eye contact with people, and or some parents just say that is a normal thing to do and I want my child to do normal things. A big one that I hear very often is, if my child just looks, if they just make eye contact, then I know that their attention and their focus will be so much better. There could be different reasons why a person may have minimal eye contact with other people, especially in social situations. But what I'm talking about in this video is neurodivergent kids, mainly autism, because there tends to be a greater association with minimal eye contact and autism, and that's what I want to address more in this video. The more and more I talk and work with parents, the more I realize that a lot of people aren't aware of the perspective or the experiences of autistic people and what it means to make eye contact with other people. And the beautiful thing about this day and age with social media and technology is that we have the opportunity to hear more from autistic voices. So from people, adults that have autism, and what their experiences are, for us to truly understand and gain more knowledge and awareness from their voices. We can use that information when we're working with for me, working with autistic kids or working with parents, and what that means. So I actually found an article from 2017 that I think brings a really good snapshot of the perspective of autistic teenagers and adults and their experience or their perspectives of having to maintain eye contact. And through reading the article, I think it has a lot of really good information. There are a lot of overarching themes that were discussed in the article. One of them is that some of these people experience adverse reactions. So needing to maintain eye contact can invoke anxiety, fear, and panic while having and maintaining that interaction. Some people receive physiological reactions. So needing to maintain that eye contact causes them to have different feelings, including feeling dizzy, feeling lightheaded, getting headaches, just from that interaction of making eye contact with someone. There are even quotes in the article from multiple people saying that the sensation of needing to make eye contact with someone is similar to the sensation and the feeling of staring into the sun. That's how uncomfortable and painful the experience is to have to make eye contact with someone. Some people also discussed how needing to make eye contact felt like a threat response for them. And there was even a quote in there with someone saying that having that eye contact makes them feel like they're a prey and they were just spotted by a predator. So causing that fight or flight response. Other people discussed how it is sensory overload, how it feels overwhelming, it feels exhausting to have to maintain eye contact. Other people said that it feels unnatural for them. And some people who are aware of the social nuances say that they feel embarrassed when they have to make eye contact, because some people have commented about how that autistic person is glaring at them or that they're staring very intently, which causes embarrassment for them. And what I just discussed were just a few of the examples. It was a very informative and eye-opening article for me also. Just hearing the direct quotes and hearing the analogies that autistic people have needing to make eye contact. And I think this is just another example discussing how not everybody is the same and not everybody processes information the same. And I think it's helpful to have that awareness as parents or as teachers or as therapists. Why are we trying to force certain behaviors on people when it could be physically uncomfortable and physically painful for them to have to do so? So with that information, sometimes I challenge parents and I ask them, is it that you want your child to have better eye contact, or you want your child to have better attention and focus? And I feel like a lot of times people think that they go hand in hand. So eye contact equates to focusing and paying attention. And I understand that standpoint because for neurotypical people, that tends to be the case. If someone is looking at you or they're making eye contact with you or they're looking in your direction, that is a cue, a social cue or social norm that the person's listening and is attentive. And I think that if we take a step back and we truly think about it, they don't need to be the same. There are a lot of people that can pay attention and can focus without needing to make eye contact. I make the example of when people are trying to solve math problems, or I should say myself, because I'm not good at math. So when I try to do math problems, if you give me a calculation, I'm probably going to be looking up or looking to the side or closing my eyes, trying to do the math problem in my head, because that's how I can focus, because it's something that's tricky for me and it's something that I don't normally get. Even when I'm recording these videos, my family always jokes because half the time they see that I'm like rolling my eyes or I'm looking up, and it's because I'm trying to think through what I'm going to say next, or I'm trying to think of how exactly I want to explain something. And for me, sometimes I just need to look up for a second to just like really try and focus on what I'm trying to say or what's going to come out next. And that's coming from me, who's not autistic, who is neurotypical, and I still have to try and close my eyes and think about things in order to focus. So if we're thinking about someone that's neurodivergent and how different that might be for them to be able to focus or pay attention. And again, I'm not saying that all neurodivergent people or all autistic people can't make eye contact or that it's painful for them to make eye contact. But I do think it's helpful to be aware of some people's experiences directly from their voices and from people who are neurodivergent. So if we start to look at eye contact and attention as two separate things, two separate pieces, there are different ways for us to understand that someone is paying attention without needing to make eye contact. So as an example, there's a family I was working with, and the son has ADHD and he's homeschooled. And the mom was telling me that when they're working on assignments or they're reading him a story, the son will tend to walk away, move his body around, do different things. And initially they assumed that he wasn't paying attention, but then after they finish reading the story or talking about whatever, they'll ask the son and he'll be able to repeat back everything that happened in the story or whatever lesson they were working on. And so the mom realized, she's like, I know he's paying attention, but he also needs to move his body. And when we ask him these questions, he can answer them. So we just keep letting him do that. And I'm like, perfect. You know that your son's paying attention. You know that his body needs to move around, and forcing him to sit down and to stare at the book or to stare at you while you're reading the book, he actually might lose his focus a little bit more because he's working so hard on trying to look or appear a certain way in order for it to look as if he's focusing, when in reality, he might not look as if he's focusing, but he is. I acknowledge that eye contact can be a form of understanding if a child is paying attention or not, but not always the case. So if I'm working with a child with autism, if we're playing a game or doing something else, I'll note they had more eye contact on their own, and I could tell that it was more than normal, so they were very attentive with me. But sometimes I'm not even thinking about the eye contact. I can tell that the child's really engaged in what we're doing by the proximity. So how close are they to me? Do they just run away very far and they're not even listening to my voice? Then I know they're not paying attention to me. But sometimes they might walk away, but then if they're really engaged, they'll come back. They'll play whatever game, they'll walk away, and then they'll come back. So sometimes I use the proximity and closeness to me as a gauge for their attention. Sometimes there are kids that are very far away from me, but then I might say something and then I'll hear them laugh or giggle. I know that they're paying attention. Eye contact can be a form of understanding how a child's paying attention, but I'm not forcing them to make eye contact. I want to emphasize again that I'm not saying kids shouldn't look at things or people. Vision plays an integral part for learning new skills, having safety awareness, and processing information from our environment. However, we should not push anyone to make eye contact for the sole reason of conforming to social norms. And going back to the question that I ask parents, is it eye contact that you really want, or is it paying attention? Some parents say, I just want my kid to look and appear normal, or I'm really afraid that they're going to be bullied, or I don't want them to look different, and that's why I want them to be able to fall into these social norms. And I do want to acknowledge and empathize that these fears and concerns are real, and I'm not trying to dismiss them or disregard them at all. I feel like this topic in general is another conversation, another rant later about what we as a society need to do revolving neurodivergence. But I think it is helpful to have this awareness of what these kids may be experiencing, because I really don't think that everyone's aware or have heard from autistic people in general about their experiences. And even though I make these videos for parents, I know that there are some autistic adults that do watch my videos. So as an autistic adult, if you have any insight or any perspective to this, whether you agree, disagree, whatever it may be, I'm always open to hearing your thoughts too. Thank you all for watching. I appreciate it, and I hope this information was helpful.